Hi, welcome back to my channel. In this video, we will be talking about the anti-diabetic drugs. So for anti-diabetic drugs, you should know the functions of insulin. So insulin basically increases the glycolysis, then it increases the uptake of glucose in cells by increasing the GLUT4 expression. Then it inhibits gluconeogenesis and it inhibits glycogenolysis. Now let's talk about the classification. So in classification, basically, just give me a second. In classification, so anti-diabetic agents. So I will divide them into two. One is oral, and one is parenteral. All right. Now in parenteral, you need to know about three basic things. So we have insulin, then we have GLP analogs, and then we have the amylin analogs. All right, now in insulin, this is important. Insulin, as you know, type 1 diabetes mellitus treatment, right? Now this is further divided into three forms. So we have rapidly acting, then we have short acting, then we have intermediate, then we have long acting. Now in rapidly acting, you have to remember the mnemonic, which is lag. All right, now from lag, how you will know is one is Lispro, second is Aspart, and third is Gluli. Just give me a second. It is glulisine. Now out of all these, Aspart is the fastest. Now in short acting, you have to remember it through SRS. So S is short acting and R is regular insulin. Now regular insulin we can give IV, so you have to remember this point. All right, IV, then regular insulin, then S is for semi-lente, which is a zinc amorphous form. Now to remember intermediate acting, you have to remember ILN, interlaryngeal nerve. So from L we have just lente, and by N we have NPH. So NPH is nothing but neutral protamine hagidon, and it is also called as isophane. Now in long acting, for long acting you can remember the mnemonic as LG. So basically LG is L, good, right? Life's good. So just remember it this way. Now here LG is long acting, so good. So from G we have glargine, by U we have ultra lente, by D we have D gludec and detemir. Now D glutec is the longest, and there is one point about glargine, that it basically functions at a pH of 4. All right, so these are the classifications of insulin. Now insulin, you need to know a few more points. Now all insulin preparations are, I'll just write small. So all are given subcutaneously, except regular insulin, which I told is given IV, right? Then there is one more, Alfreza. So this is a recent drug, which is the inhalational insulin. Then rate of absorption. In rate of absorption, you should know that it is highest for abdomen, then it is for arm, then it is for buttocks and thigh. Then most common complication is hypoglycemia, and most common complication at injection site is lipodystrophy. All right, now let's talk about the GLP analogs. In GLP analogs, you have to remember only 2-3 names. So GLP analogs is basically nothing but what we call as incretins. So these are exenatide, liraglutide, and semaglutide. Then let's talk about amylin analogs, which is the pramlintide. Alright, now coming on to the classification of oral. Now in oral you have to remember two basic things. Now in oral what you will get to see is, in oral you will have two types. One is which increase the insulin secretion or release. I'll write release. So in this you have sulfonyl urea, which has chlorpropamide and tolbutamide. This is short acting, this is long acting. Alright, then we have meglitinides. In meglitinides we have repaglitinide and natglitinide. Now I'll just brief you about the so in the second one we have other mechanisms. Okay, we will just talk about them. So in this sulfonyl urea and meglitinides, you need to know a few points. First of all, they act by inhibiting the ATP sensitive K positive channels. Alright, and side effects are jaundice, dilutional hyponatremia, and disulfiram like reaction. Alright, now let's talk about the other mechanisms. Now since the space is less, so I'll just do it here. Oral anti-diabetic agents. Basically we are talking about other mechanisms. Alright, now in this you need to know few ones which are important. So first one is biguanides. In biguanides, if you remember, we have metformin and fenformin. So this is discontinued, metformin is used. Now biguanides, basically metformin, they act by the inhibition of the AMPK enzyme. Then you should know that metformin side effects. So metformin causes vitamin B12 deficiency. Alright, then coming on to the second one, which is the thiazolidinediones. Now in metformin, you should know that it basically activates the AMPK. So yeah, and it causes lactic acidosis. Alright, now in thiazolidinediones, so basically they act on PPAR gamma, which is nothing but a nuclear receptor for peroxisome proliferative activated receptor gamma. So this upregulates gene transcription. Now which all genes are in this, so you can remember it by IGAF. So I is basically insulin receptor substrate, then from G we have GLUT4, then by A we have adiponectin, and by F we have fatty acid transport protein. Alright, now thiazolidinediones, whatever, they basically decrease the insulin resistance in type 2 diabetes mellitus. Side effect is they increase cholesterol, especially rosy glitazone. Pioglitazone also increases cholesterol, but mainly HDL cholesterol. Then they also lead to edema, so contraindicated in CHF patients. Alright, then coming on to the other third one, which is, so I'll use another third one. So after this we have the alpha glucosidase inhibitors. Now alpha glucosidase inhibitors, now in this you have acarbose and migitol. So this is absorbed in GIT and the carbose is not. So they basically, we have, like in diet we take complex carbohydrates. Now they are broken down into simple carbohydrates and then they are absorbed, and here is the action of the alpha glucosidase. So basically what we are doing is we are inhibiting this enzyme, right? So we are inhibiting this enzyme. If we do this, so there will be increase in complex carbohydrates in the body, which will lead to flatulence. So this is the adverse effect because of the due to the fermentation of unabsorbed carbohydrates. All right, this is the function of alpha glucosidase. Then coming on to the fourth one, which is GLP-4 analog and DPP-4 inhibitors. Now this is a small story. When insulin was given oral and it was given IV, when it was given oral there was seen the 3-4 times more increase in insulin. So they thought ki why not from IV. So what happens is there is the increase in the GLP analogs. So but this has a short t-half of 1 to 2 minutes. Why so? Because there's a DPP-4 enzyme which acts on it and metabolizes it. So in short, if we want to counteract diabetes, we need more of GLP-4 and less of DPP-4. So we give GLP-4 analogs and DPP-4 inhibitors. All right, so this is the short story. So in GLP-4 and DPP-4, right, so basically one thing more, that they are contraindicated in the medullary thyroid carcinoma. Now in this we have semaglutide, liraglutide and so on. And then there is another class which are the D2 agonists, now dopamine agonist. So in this we have bromocriptine mesylate. All right, then all of these are done. Then in amylin analog we had pramlintide. In pramlintide, basically it is the only drug plus insulin which has been approved for both type 1 and 2 diabetes mellitus. Now in one more, in meglitinides, you should know that these are used for the postprandial treatment. Postprandial, basically hyperglycemia treatment. All right, then the only oral anti-diabetic that basically decreases macrovascular events in type 2 is metformin. In DPP-4 inhibitors we had where did I write it? We had semaglutide, liraglutide. These are GLP-4 analogs. We had exenatide, as I told you before, and we had liraglutide and semaglutide. In DPP-4, I forgot to write, these are the gliptins. So sitagliptin, vidagliptin, and so on. Now here we have one more, which is 4, 5, 6th. So I'll write it here, which is the SGLT2 inhibitors. Now SGLT2 inhibitors name is dapagliflozin and canagliflozin. So basically SGLT2 basically transports the glucose. So what happens is they prevent the reabsorption of glucose from PCT. So increase in glucose excretion. So adverse effect is that there can be urinary tract infection. So these are the anti-diabetic drugs, and I hope I made it easier for you to understand. If you like the video, do subscribe to my channel and give this video a like.